A randomized control study of contrast baths on patients with carpal tunnel syndrome by Claire Clausen and Jacob Paquette.
The level of evidence for this article is level 1B, and that's because it was a randomized controlled trial and participants were randomly assigned to one of 3 treatment groups. The null hypothesis of the researchers was that there will be no significant increase or decrease in hand volumes using any of 3 treatment protocols described below, regardless of whether the treatment occurred pre- or post-operatively.
Subjects of this study were recruited from a hand therapy clinic between July 2004 and May 2005. They were all above 21 years old, and the researchers got their written consent before starting treatment. They had to have a diagnosis of carpal tunnel syndrome as well. The exclusion criteria was a diagnosis of a comorbid hand condition, diagnosis of a neurologic systemic condition, and alteration of a previous carpal tunnel release surgery. There were 3 different treatment groups for this intervention. Treatment group 1 had contrast bath protocol with composite fisting exercises in the water. Treatment group 2 had contrast bath protocols without exercises in the water, and treatment group 3 had exercise-only protocol without the contrast bath to determine if exercise only would change hand volume. The contrast bath protocol used a 1-to-1 ratio of 1 minute of hot water at 105 degrees Fahrenheit, then 1 minute of cold water at 70 degrees Fahrenheit. Controlled finger flexion and extension exercises were instructed by the therapist, which included opening and closing the fingers into full extension over a time of 6 seconds. Exercise during the contrast baths were thought to amplify the assumed pumping action the contrast bath was to impact on the hand.
The outcomes of interest of this experiment were objective because they were strictly measuring the hand volumes, and they were not subjective because there were no opinions of the participants recorded or measured.
The changes in hand volumes were analyzed using one-way and multi-way analysis of variance. The checks for interactions with other variables such as time and sex showed no significant effects.
Each intervention resulted in a small statistically significant increase in hand volume with an average of 5.8 milliliters. However, a previous study by Waylett, Randall, and others on the accuracy of the hand volume meter determined that a change in hand volume must equal at least 10 milliliters in order to be clinically significant. Therefore, the findings were statistically significant but not clinically significant. There were many variables that can affect outcomes, such as time spent in immersion, the temperature of the water, and incorporating exercises both in and out of the water. And the researchers suggested that there are possibly other benefits of contrast baths for future research, and they suggested measuring the reduction of pain. They also said that future studies should choose participants with different diagnoses that are more typically associated with increase in hand volumes, such as patients with distal radius fractures or crushed hand injuries. Strengths of this study include that the results are in agreement with previous literature, such as by Brigger and others, and that the power analysis had results greater than 99%. Limitations of the study included the core temperature of the subject's hands, and it suggested that it did not reach the required temperature needed for physiological change due to the frequent alternation between hot and cold. And they also suggested that the water temperatures may not have been hot or cold enough to produce the anticipated change in hand volume. And as previously discussed, they suggested that the use of carpal tunnel patients as the sample was also a limitation, and that future studies should use different participants with different diagnoses.
The implications for practice are if the same protocols are followed, we can suspect all 3 contrast bath treatment groups will have no significant increase or decrease in hand volumes. As we grow as practitioners, we need to continuously research evidence-based interventions that we can use for our specific clientele populations. And for this example, this one was in an outpatient hand therapy clinic. But in the future, we may be working with children, we may be working with older adults, So we just need to keep up to date and continue to be an active learner as we grow in our careers.